Hi, this is Travis Pearson. I am doing Mb664, my weekly journal. I'm supposed to discuss a patient interaction where I had transference, countertransfers, bias or prejudice or judgments that you make about patients or that they're verbalizing about you. I guess I didn't have it this week, but it was in the last semester I had one. It was I had some bias, I guess, because as a parent, I have a hard time with parents that may not have the capacity or understanding. This with the child that they didn't discipline their child any way, what shape, form, and I was like, how can you do that? Like, I'm not like an extreme disciplinarian, but I mean, children need to have like values put on them, or not values. They just respond well to boundaries where they push across the line and then they learn that that wasn't good. Then they had to go into like a timeout or something. And I'm like, when that doesn't happen, it frustrates me, because then they come into the clinic and then they're like, this kid is out of control. What are we going to do with him? He needs medication. And I'm like, I don't know exactly if it's the kid or the situation. And those cause me to have a hard time. Have I encountered this before? Not to the level that I've had since I started as a psychiatric nurse practitioner and dealt with a few of these parents. I don't know where this originates from. I guess I grew up in a very authoritarian environment. It was very strict and rigid, and I'm not as rigid as my parents are, but I do believe in having some base lines that you try to establish. Would it be appropriate for you to continue care for these patients? I don't know, that seems like a very tough subject to determine if I would continue care. Children have always been a tough avenue for me to address, because there's a lot of horrific things that happen to kids. I have kids. I think that biases my opinion. I'm not sure that children are where I should spend the most time. Now, I think I could learn with patience, time, and understanding to move into that segment. But right now, I think I just have to focus on adults. I can do better. Even though they're a difficult group, they are not at such a vulnerable stage. I feel that's just a very difficult stage. And it's very hard for me to work with that particular group, understand all the needs that they have, all the problems that go on. It's just tough. So that's my journal for this week. Thanks, Travis Pearson.